Paroxetine is a selective serotonin reuptake inhibitor used to treat major depressive disorder, panic disorder, OCD, social phobia, generalized anxiety disorder, the vasomotor symptoms of menopause, and premenstrual dysphoric disorder. In this video, let's found. What is paroxetine? What is paroxetine used for? Contraindication. What are the side effects of taking paroxetine? How does paroxetine work? How to use paroxetine. What is paroxetine? Paroxetine, sold under the brand names Paxil and Seroxat among others, is an antidepressant of the selective serotonin reuptake inhibitor class. It is used to treat major depressive disorder, obsessive-compulsive disorder, panic disorder, social anxiety disorder, post-traumatic stress disorder, generalized anxiety disorder, and premenstrual dysphoric disorder. Paroxetine was approved for medical use in the United States in 1992 and initially sold by GlaxoSmithKline. It is on the World Health Organization's list of essential medicines. It is available as a generic medication. In 2020, it was the 82nd most commonly prescribed medication in the United States, with more than 9 million prescriptions. In 2018, it was in the top 10 of most prescribed antidepressants in the United States. What is paroxetine used for? Paroxetine is indicated for the management of depression, obsessive-compulsive disorder, panic disorder, social anxiety disorder, generalized anxiety disorder, post-traumatic stress disorder. One form of paroxetine, commercially known as Bristol, is used to manage mild to moderate vasomotor symptoms of menopause. Off-label, paroxetine may be used for the treatment of premature ejaculation or irritable bowel syndrome, IBS. Contraindication. Concomitant use in patients taking monoamine oxidase inhibitors, MAOIs, and pimozide is contraindicated. Also contraindicated in patients with a hypersensitivity to fluoxetine, hepatic or renal insufficiency. Side effects. Paroxetine shares many of the common adverse effects of SSRIs, including, with the corresponding rates seen in people treated with placebo, in parentheses. Nausea 26%, 9%. Diarrhea 12%, 8%. Constipation 14%, 9%. Dry mouth 18%, 12%. Somnolence 23%, 9%. Insomnia 13%, 6%. Headache 18%, 17%. Hypomania 1%, 0.3%. Blurred vision 4%, 1%. Loss of appetite 6%, 2%. Nervousness 5%, 3%. Paresthesia 4%, 2%. Dizziness 13%, 6%. Asthenia, weakness, 15%, 6%. Tremor 8%, 2%. Sweating 11%, 2%. Sexual dysfunction, greater than or equal to 10% incidence. Pharmacodynamic. Paroxetine treats the symptoms of depression, various anxiety disorders, post-traumatic stress disorder, obsessive-compulsive disorder, and the vasomotor symptoms of menopause via the inhibition of serotonin reuptake. The onset of action of paroxetine is reported to be approximately 6 weeks. Due to its serotonergic activity, paroxetine, like other SSRI drugs, may potentiate serotonin syndrome. This risk is especially high when monoamine oxidase, MAO, inhibitors are given within 2 weeks of paroxetine administration. Upon cessation of MAO inhibitors, an interval before paroxetine administration is recommended. Do not coordinate these agents. Mechanism of action. Paroxetine enhances serotonergic activity via the inhibition, presynaptic reuptake of serotonin by the serotonin, SERT, receptor. This inhibition raises the level of serotonin in the synaptic cleft, relieving various symptoms. This drug has been demonstrated to be a stronger inhibitor of serotonin reuptake than other members of the same drug class, including citalopram, fluoxetine, and fluvoxamine. The mechanism of action of paroxetine in relieving the vasomotor symptoms of menopause is unknown, according to the Bristol prescribing information, but may occur due to its effects on thermoregulation. Paroxetine shows a clinically insignificant affinity for adrenergic alpha-1 and alpha-2 receptors and beta-adrenergic receptors, dopamine D1 and D2 receptors, histamine H1 receptors and serotonin 5-HT1A, 5-HT2A, and 5-HT2C receptors. This drug shows some affinity for muscarinic cholinergic receptors and 5-H2B receptors. The delayed onset of paroxetine therapeutic effects may be explained by the initial paroxetine actions on the 5-HT neurons. In rats, paroxetine activates 5-HT1A receptors when it is first administered, inhibiting the stimulation of the 5-HT neurons and subsequent release of serotonin at the synaptic cleft. Half-life. The mean elimination half-life of paroxetine is about 21 hours. In healthy young subjects, mean elimination half-life was found to be 17.3 hours. Dose. Depression. Conventional, 20 mg PO/day initially, may increase by 10 mg per day q-week, not to exceed 50 mg per day. Paxil CR, 25 mg PO/day initially, may increase by 12.5 mg per day q-week, not to 62.5 mg per day. Obsessive-compulsive disorder. 20 mg PO/day initially, may increase by 10 mg q-week, not to exceed 60 mg per day. Panic disorder. 10 mg PO/day initially, may increase by 10 mg q-week, target dose 40 mg per day, not to exceed 60 mg per day, or Paxil CR, 12.5 mg PO/day initial, increase by 12.5 mg q-week, not to exceed 75 mg per day. Social phobia. 20 mg PO/day or Paxil CR, 12.5 mg PO/day initially, may increase by 12.5 mg q-week, not to exceed 37.5 mg per day. Generalized anxiety disorder. 20 mg PO/day initially, may increase by 10 mg q-week, up to 50 grams per day. Doses have been used, but no increase in benefit seen at doses greater than 20 mg per day. Post-traumatic stress disorder. 20 mg PO/day initially, may increase by 10 mg q-week, up to 50 mg per day. Doses have been used, but no increase in benefit seen is greater than 20 mg per day. Premenstrual dysphoric disorder. Paxil CR, 12.5 mg PO/day initially, may increase at 1-week intervals, not to exceed 25 mg per day. Menopausal vasomotor symptoms. Bristol, indicated to treat moderate to severe vasomotor symptoms associated with menopause. Bristol, 7.5 mg PO/QHS. Paxil CR, off-label, 12.5 to 25 mg PO/day. Vasovagal syncope, off-label, 20 mg per day PO. Diabetic neuropathy, off-label, 10 mg per day PO initially, may increase to 20 to 60 mg/day. Safety advice. Paroxetine actually carries a Category D rating from the U.S. Food and Drug Administration, FDA, for safety in pregnancy. 2 studies have found an association between first trimester paroxetine use and congenital malformations, notably cardiac malformations. That's all the information about paroxetine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.